Hi there, my name's Dr. Laura Powell and I'm one of the palliative care consultants here at the hospitals over at Bristol and Weston. And I'm going to talk today about planning ahead what matters to you. So this is a talk that will probably take about 20 minutes or so, and it covers quite a big topic, really. So I hope what this does today is give you some food for thought, really, about what maybe is important to you to think about, and would urge you, at the end of this, if it feels like a lot of information, please just talk to your healthcare professionals about it, talk to your family about it, and then I'm hoping that it will be a really useful tool for you to start thinking about some of these issues. Okay, so this is a quote from a patient that's actually come to one of the palliative care clinics where we've talked about future care planning with the patient. And I'll read that quote out. So for us, the fact that we talked about it all so much in advance made it easier and brought us closer together. And that's really the aim of talking about future care planning and thinking ahead. So what I'm going to talk about during this presentation today is what I mean actually by future planning, what that actually is, why we do it, how you might start that conversation with your healthcare professionals or with your family and friends and loved ones, and what kind of topics routinely come up in these conversations to get you thinking about those. At the end, I've put some resources, just a few simple resources there, just to, again, give you somewhere to look at next as next steps if this does spark some interest and you think, oh, that's really relevant for me or my family. Okay, so I think really it's important to say, what do I mean by care planning? And this isn't a one-off event where you sit down and you plan everything. This is an evolving process where it will, your views and your wishes and things that are important to you will change over time. What it's really about is sitting down and having a conversation, truly understanding what's going on with your healthcare, what we might routinely expect for the future to be like, and what are your individual wishes and priorities and what's important to you as an individual, taking all that into consideration. And then sometimes we'll document that and make sure we share it with all the relevant people involved in your care as well. So that's what care planning is in a nutshell. Okay, so why do we plan ahead? Well, we know that when people have serious illness, that can be a really difficult time. It can be a very busy time. It can be confusing. And, it can feel like you've not got the control over things that maybe you would wish for. The point of planning ahead is to think about creating a time and space to think about what's important to you, to take a step back and think, what decisions can I make? What am I in control of? What do I need to think about, and make sure that your voice and your wishes are truly heard and you've had time to share that with the people that are important to you. And we know when we speak to people that can give a sense of control back and can really help manage some of the uncertainty that we know that people face. And it, as I say, it can ensure that your wishes are known. And again, at the end there's a quote from a patient that's been to clinic to discuss some of these things, and actually focusing on having the time to focus on some of these things that actually it allowed to give them the freedom to focus on living in the now, knowing that they plan for the future a little bit. So that's what it's really about. It's meant to be something that's really helpful and gives a bit of time back to you to think about what's important. Okay, so where do you start? We know people can find this challenging and it feels like a big topic and people aren't always quite sure where to start. Again, as I say, it will be an evolving conversation. So certain parts of what I talk about today may feel relevant for now. Some of it may feel less relevant, but may become relevant into the future. So it's about starting the conversation with those that are important to you. You might want to speak to your healthcare professionals first to try and truly understand what decisions might be important for you to make. So that's a really good place to start. And then we may document some of that as well. People worry that these conversations, when you talk too much about the future, can be upsetting or can cause even more kind of confusion or distress for people. But we know that actually the opposite is usually true, and that most people, whether you're a patient or whether you're a loved one or a relative of someone that has a serious illness, these thoughts go through people's minds all the time. People naturally think about their future and what might happen next. And so having a space to really think about those and talk about them is normally a great relief to people. Okay. So moving on to what people, when we have these sessions with patients, what do people normally want to talk to us about? And I think it comes down to three. We've split this into kind of three categories that people often talk to us about. The first being personal, what we've classed as kind of personal things to think about, legal and financial, and also healthcare issues to think about as well. Okay, so personal and practical things that people bring up with us and that we'll speak to people about is, one, just how do you want to spend your time? Your time is really important, especially when you may be coming into the hospital a lot for appointments and treatments. Actually, that time can feel really squeezed where you just have time for yourself and your family. So thinking truly how you want to spend that time. And maybe telling the people you love. I come across people that have one way of, they want to get things sorted. They may want to, I had a patient recently that wanted to really sort out the garage. They felt that that was really something important that only they would be able to do. And the people around them couldn't quite understand why that felt so important and why they didn't want to do things that were more fun or kind of different priorities. So it's truly thinking about what do you want to do and why, and being supportive of those things. Lots of people think about caring for their family as part of this. So if you're a carer for children or parents, often people will raise queries about how they can support those people. And that might be around financially and thinking about money and finances. Or it may be about more kind of hands-on care and how you might support that going forward. And that comes under the support for those closest to you and kind of how do you want to spend your time? Where do you want to be with your time? So all of those things are really important to think about. Legal and financial concerns. So lots of people will raise questions around how do I make a will, or should I make a will? Is that important? They may have questions about pensions or life insurance, or they may have this all sorted already, but want to make sure it's all in a sensible place and the people that will need to have access to that information have access to it easily. So for some people, that's really important to think about and can be a great relief to know that that is sorted. Some people want to make something called a lasting power of attorney, which I will come to a little bit more in the healthcare section. But there are two forms of a lasting power of attorney. And what this does is means when you are well, you can appoint trusted people to look after your finances or be a spokesperson for your healthcare if you become so unwell that you are no longer able to do that for yourself. So some people want to do that for their finances and make sure that their family or their next kin or their loved ones have access to all the things that may be important in the future. And some people will want to look at different ways of financial support. We know that when people are unwell, their normal ways of financial support may have stopped. So you may not be able to work, or your family situation may have changed in that regard. So again, thinking about some of those issues and the effects of illness that can have on your finances are really important things to think about. And there's lots of support out there to give you advice and help with those things as well. Okay. As a doctor, the biggest part of this that I often talk to people about is what is their healthcare future care wishes. And you may hear people kind of term this as advanced care planning. And what we mean by this, again, is discussing the healthcare choices that you have and documenting them. Again, it's about making sure your wishes are known and that you've shared those with relevant people. So, for instance, your GP and your oncology team or the hospital teams, so that anyone you come into contact with will understand fully what's important to you. Okay. I think it's important to say that when we're talking about planning ahead, we do it in advance for a reason. So it doesn't mean that you're giving up in any way. It doesn't mean you're near the end. It's not supposed to be a negative thing. It's meant to be about giving you choice and hearing your voice. So again, that's a quote there. That doesn't mean you're giving up or near the end. People review their ideas a number of times. Okay, so when I talk about advanced care planning with patients, what do I talk to them about? Well, one, it's about a shared conversation of, what's happening with your healthcare and what might I expect for you as a doctor to move forward as time goes by. What are our expectations for the future, as best as we can ever know? And we talk about what's important to you in terms of your healthcare, and this certainly evolves. So it may be that at the start of these conversations, you very much would want certain treatments. You would want to come to hospital. You would want every treatment possible. It may be that in the future, if you're less well, those things may feel less important, and being at home more, or spending time with family and focusing on symptoms and comfort may feel more important. So again, it's an evolving discussion that will change over time, and that's absolutely okay. It's really important, as well as what you do want, to think about sometimes what you may not want. And some patients we see have very strong ideas about what they really wouldn't want to happen to them. And I won't go into a lot of detail today, but there are things we can do as well to document those wishes, to make sure that your wishes are heard and listened to, even if you're so unwell that you can't tell us those at that time. So there's a form, which is a legal document called an advance decision to refuse treatment. Not many people actually complete these, I would say, but if you've got really strong views of things you wouldn't want, then these can make people feel really better protected in their choices. And again, it's something, if there are things that you absolutely wouldn't want as part of your healthcare, then please do speak to your healthcare providers. That'll be able to talk you through this in a bit more detail. And again, who would you like to speak to you? And again, I mentioned that the lasting power of attorney there. So as I said earlier, there are two types, one for finance and one for healthcare. If you decide to appoint a trusted person, an attorney, to look after your healthcare needs, if you become so unwell you can't make decisions for yourself, what that would mean is that the doctors would speak to that person and they would act on your behalf, making decisions for you. So again, if you don't appoint a lasting power of attorney, the doctors would speak to your next of kin and your important nominated persons anyway, and make a best interest decision on your behalf. If you have a lasting power of attorney, it really guides us who to speak to and really guides your wishes as well. I think it's worth just popping this in there because this is used across Bristol and across Weston, both in the community, so it will be used by GPs, but throughout our hospitals as well. Now, this is called a respect form, and it's used for all patients in all circumstances. But what it allows us to do is, on one simple form, allows us to document some of your healthcare issues and some of these decisions that we've made around healthcare, whether it be what treatments might be appropriate or what treatments may not be appropriate. And again, your doctors or your people involved in your healthcare would absolutely talk to you about these issues, so you would know what's on this form. You would keep a copy of the form yourself, and it allows you to very quickly get across a picture of what's important to you to maybe people that don't know you so well, if you ever need to in a more of an emergency type situation. And I think you are likely to come across this term and maybe see these forms in the future. So again, just to really see what they look like and understand what they're there for. Okay. One important part of when we talk about future care planning for people with serious illness is obviously planning for the end of life as well. And again, for some patients, this can feel like a really challenging area of things to talk about. For other patients, it's a really reassuring thing to make sure that you've talked about these things and to make sure absolutely your family and the people around you truly know what's important to you. And things that people often want to talk about is what they want that care to look like at the end of life, where they might want to be, for example. Would they want to be at home, for example? Lots of people tell us that. And again, for some people, that's much less important, and it's just about who's with them and making sure that, for example, lots of people tell us it's just about having family around me and being comfortable. So lots of people will have very different views on this. And the more we talk about it, and the more likely we are to absolutely get it right for you. And that's really important. Okay. So I think I've spoke about quite a lot of things there. I guess in summary, I wanted to just finish by saying planning ahead can allow to make you feel that your voice has definitely been heard by your family and by your healthcare teams, and make sure people truly understand what's right for you and important for you. On the whole, people find this a relief to talk about. That doesn't mean it's easy, but it's once you've started these conversations over time, it does get easier, and it does provide people with some real relief that they know that what's important to them and their family has been spoken about. And just to know, there's a lot of resource and support available in your choices, in your decision making, in doing some of this work. So please do ask for help. You don't always have to wait for your healthcare professionals to start this conversation or your family to. You can bring these things up, and we'll be absolutely happy to talk to you about these things. And if that healthcare professional can't answer those questions for you, they should be able to point you in the right direction of other teams that maybe can. Okay. There is a huge wide range of resources from the hospital, from lots of different charities available if you want to think and read about this in a little bit more detail. I've just put a couple of things up here which might be useful starting points, really. So Macmillan Charity have on their website and in our hospital hubs have lots of information available in leaflet form. One particularly helpful booklet for this topic is called Planning Ahead. So again, it covers in much more detail some of the things I've talked about today, and I'm sure more eloquently. So please do pick one of those up or speak to your specialist nurses and teams that will be able to get one of those to you if you'd like that. I've put the government.uk website up there, which can easily be Googled. And if you're particularly interested in some of the legal things and financial things I've spoken about, so lasting power of attorneys in particular, or advanced decisions to refuse treatment, again, that's a really good website to explain what they are, when they might be appropriate, and how to apply for those things if that feels important to you. And as I've said throughout, please do speak to your healthcare teams, whether that be your GP or your specialist nurses or your oncology team, or you may well be known to the palliative care team. Please do speak to them, or maybe even the hospice team. So whoever you're known to and that you trust, do speak to about these issues. And that's my last slide. So thank you for listening to the whole talk today. And as I say, please do ask for more information.